you have a weak chin or a recessed chin or your chin is sitting back, I think I have the solution for you. Understanding that it's temporary, it's not something that necessarily fixes it completely. The next option, if you're more of a set it and forget it, more of a commitment type person, a long-term commitment type person, then, the results last forever. Do you avoid taking side profile pictures because you have a weak chin or a recessed chin or your chin is sitting back? I think I have the solution for you. If you like this type of content and you're interested in surgical or non-surgical facial aesthetic videos, like and subscribe for more, leave comments, leave topic ideas below, and I'll maybe make your video for future videos. So let's get into the ways to improve your side profile and give you that jawline and chin that you have been craving. So there are two treatments that I love for improving and enhancing your chin. I will tell you that if you have commitment issues, then I'm going to give you an option for that. But if you don't have commitment issues and you're interested in a long-term solution and something that's just going to kind of set it and forget it, then I also have a treatment option for you. So let's start with chin filler. So filler is a hyaluronic acid. It is used to enhance, improve, and just give you overall enhancement in your chin and jawline. This is a HA filler. It's a dissolvable filler that can be injected down to the bone to kind of shape, contour your chin and jawline. Typically, you need multiple syringes to really be able to kind of improve and enhance your result. It doesn't last forever. You will need maybe an injection in 6 months, a year, depending on how quickly your body absorbs or breaks down that filler to maintain that result. So understanding that it's temporary, it's not something that necessarily fixes it completely. But if you're interested in a test ride, if you're not willing to commit to an implant or you're afraid of an implant, then I think filler is probably one of the best solutions to start with. It's an easy procedure. It's done in the office. It's done under local. There's minimal pain. Honestly, I think most people have minimal to no pain during the procedure. It does swell a little bit afterwards, but after, a few days or so, most of that swelling has come down. So the next option, if you're more of a set it and forget it, more of a commitment type person, a long-term commitment type person, then that option is a chin implant. So I have a couple different chin implants here. This is one of them. This is an anatomic chin. There's a lot of different shapes and sizes. As you can see, these chin implants can be inserted through a small incision underneath the chin in one of your natural creases. So it's very well hidden. No one can see it. It's also can be done in the office. It does require more commitment on your end, more significant of a downtime. And there's obviously bruising and swelling with any type of surgical procedure. So the procedure itself probably takes about an hour and a half of your time. You go home the same day. You wear a chin strap for about a week or so. Bruising and swelling is very normal for at least a week. So about 7 to 10 days of downtime. And, the results last forever. This procedure, a chin implantation, is the highest patient satisfaction procedure within facial plastic surgery field itself. So the patients that have this procedure done, it truly is life-changing. I mean, they absolutely love it. It improves your confidence, improves your overall self-esteem. It is fantastic. And for me, it's so rewarding. Patients love it and it's great. So this isn't very common, but let's say you get a chin implant and you feel like you need a little bit more projection or you need a little bit more enhancement of your chin and jawline or in other areas where the chin implant is not necessarily doing it. Can you get filler afterwards? It's a really good question and a lot of people ask it. Well, the first thing I will say is if you don't like your chin implant, which is very uncommon, or you feel like it's not the right size for you, whatever that may be, it's very easy to remove it. So through that same incision underneath your chin, which heals really nicely, you can do that in the office. You can take out that chin implant and you can exchange it. Typically, you can do an exchange at the time of the removal, but oftentimes you take it out, you let that area heal, and then you can put a new one in if you're thinking about kind of changing the size. But as far as using filler after a chin implant, you do have to be very cautious. The reason is because when an implant is in place, it is essentially a foreign material that can take on bacteria that can be introduced from either the bloodstream or from an external source. So if the skin is not perfectly cleaned and a needle is injected into this area and it touches the implant and it introduces bacteria, then that can cause a biofilm, which is basically bacteria that kind of lives on the surface of it and causes inflammation, reaction, infection, and can cause problems. So can you get filler? You can, but you have to be really cautious. You have to be really honest with your injector and make sure that they know that there's an implant or a foreign material in this space. So yes, you can do it. You got to be careful. It's probably best to go back to your surgeon if you need any additional augmentation or enhancement, but the answer is yes, but very, very cautiously. That's a lot of information about chin augmentation, and it's actually a very common procedure that I perform in my office. And I would say a lot of facial plastics love to do this because it's such a high patient satisfaction. Great procedure, quick, easy, in the office. If you have any other questions about chin augmentation, chin filler, chin implantation, other ancillary procedures that can go on with this, leave them in the comments, like and subscribe for more, and I look forward to seeing you guys for the future videos.